Everybody. We are here tonight. Of course, I'm Dr. Mike, Dr. Jordan, and our newly acquired Dr. Tiffany are going to be covering tonight's What's New. And we're going to be talking about a hodgepodge, I'm sure, of just, updates of what's going on with the current state of affairs with everything. And kind of getting caught up on things since last month. If you guys haven't watched the previous videos, of course they'd be in my video history, so get on and watch that. Of course they were relevant then, they're relevant now. It seems that the curve isn't really changing or catching up on things, but we're trying to keep everybody ahead on what's really going on and what's the agendas behind all of it, so that you guys know what to do as you're moving forward. So Dr. Jordan, you got anything to start us off with?
You're not immune to COVID if you're protesting. Don't want to get too political, but
well, let's go right into it, right?
Yeah. Contrary to popular belief, you could have seen this coming from a mile away. Keep everyone at home, send everyone in the streets at once. I mean, cases are going to skyrocket. I think we could have seen this one coming here. And unlike Sweden, whose majority of the population has been exposed to this in one way or another, we're definitely going to see a pretty big wave too. But I think the older people are staying at home. I think the death rates are much, much, much better compared to where we were back in April and May. So that's how I want to start,
yeah. Well, that's a good one.
Personal responsibility. If you have symptoms, you should stay home and not be around other people. Or if you have a weakened immune system or you're not confident in your immune system, stay away from those who may infect you.
A choice.
Yeah.
That is so logical. And it's exactly what we've been talking about for months and months and months. That, everybody knows that in healthcare, or should know that. I mean, we say everybody knows that, but where the heck are the experts that are giving the logical points? It seems like the only ones that are getting the points across are the parrots, which is kind of like a new term, for all the, just the talking heads. That it's like nothing is original anymore. There's no ideas, there's no it's just parroting what the media wants you to hear,
which is all fear.
Right. And why, who in their right mind as a healthcare professional would quarantine everybody when it's the sick that you quarantine? We've been doing that for all of eternity.
Mm-hmm.
But all of a sudden we just like, this is the new idea now. This is the way that we do it now. It's insane. So I you mentioned wave 2, and I wanted to put this, and it is in my news feed. If you look at the previous post that I did today, I put on there real simple, and this is not as some might say trying to fudge data. This is really just putting data on top of each other so that you can make sense of what's actually going on. And so real simple, I took the information off of a tracking website that I've been tracking since January, and you don't have to zoom in. I mean, it's all of this is on my page, so you can get on and you can actually see the chart. But this is the one that you're looking at when you get on there, and real simple. All it shows is that when you superimpose the dates from the deaths to the actual cases, you see that there is a perfectly linear slide from early March through mid-April. That it goes right up, even though they say, oh, there's a lag time, and everything else. Yes, there obviously you get sick and there's a couple weeks and everything where that goes by, but this isn't always. This hasn't been what we've seen in the data moving forward here. As far as back, you don't see this transition of data. You saw that it climbed as the attention climbed. That as the cases were getting diagnosed, you saw the death rates climb almost uniformly through it. And then, the deaths, of course, peaked out at the same time that the cases peaked out, around mid-April, which is when, of course, all the shutdowns went into play. And that's a whole different story, because of course we talk about the shutdowns might not have been the right thing to do, because you keep normal people from getting healthy. But as it slides off, now we've slid off and we've seen that the deaths have just flattened. And yet we started a spike back in the early part of June. June is when we started seeing all the numbers surge back up, yet the death rate is remaining flat, and we're in the middle of July.
Speaking of that, we had our first 24 hours of no deaths in New York City.
That's massive.
Yeah, that is massive. They were having thousands die at one point a day. That's great. Or sorry, thousands getting infected per day. Never had thousands die, I don't think.
So it begs the question that I think we even asked on the last video. Why does it seem that despite the good news that's there, nobody wants to focus on it? Mm-hmm. Nobody's talking about the good news. Nobody's talking about the fact that the numbers, yes, are escalating in the cases, but they're not in the deaths, which implies that we're rapidly approaching natural herd immunity without the deaths. Why aren't we talking about that?
You always hear the shift is don't want to overwhelm the hospitals, the ICUs. I was listening to the radio one morning on the way to work, and they mentioned that the ICUs, if you've ever been in an ER, you've probably waited, unless you're having a heart attack. ICUs are always full. I mean, if you see one at 80% capacity where they can just get you right in, that's very lucky. So ICUs, for the most part, are always full. I think the argument that, the ICUs are 98% full, 95% full, we don't need to, we need to wear a mask, we need to quarantine, that's a bad argument, because the corona wards, on the other hand,
are empty.
Aren't. Yeah. So I think that the shift at least should be talking about, maybe allowing a floor of a hospital to be just a corona ward. If it is that bad, we can take some people out of the ICU into the corona ward. But the thing is, these people aren't sick with corona. So,
we tried that.
Yeah.
Remember the ships that the Navy sent in to New York and LA, and the ships went back out after not treating hardly anybody, and that was during the peak of all. Mm-hmm. So it's mass manipulation. We were just in Texas, and they have been ridiculing Texas. Why? Is it really that bad in Texas? Not any different than anywhere else. They're ridiculing Texas because they were one of the first states to open, which is why we went on vacation to Texas. Mm-hmm. And so they said that the ICUs, exactly like you said, were completely full to capacity. Well, then they come out with someone actually looked at the data and called the hospitals and found that one of those that they quoted, only like 13% of the patients or something like that, 13, 20, somewhere in that region were actual COVID patients. Mm-hmm. Over 80% of the patients that were there for other things. So yeah, it's full, but it's not full of coronavirus.
Yeah.
And to put a little perspective on the numbers of, people being infected, and in the U.S. today, as of today, there were 44% recovered patients of coronavirus, 3.9% deaths. But to narrow it down just to Alabama, we had 1.8% deaths as of today, and Mobile County is only at 2.8%. So we're talking about how Mobile County has the second highest rates of coronavirus in the state, but we have the second highest population of people in the state. So that totally makes sense. We're still at 2.8%. And even the U.S.'s death rate is lower than a lot of other countries. France is at 15.9%. Italy, 14.4%. The UK is at 14% too. So it's not, everyone's talking about how the U.S. is doing a really poor job of how they're responding to coronavirus, but I just don't think that's the case.
Yeah. Well, they say it's because we're not containing the spread. But that's not true either. It's not about containing the spread. It's the fact that we're doing more testing than anywhere else around the world. Mm-hmm. Yet, of course, again, not to get political, but, the president has supposedly failed in every regard, in this fight against COVID. Yet we have the capacity to test higher than anybody else, which is represented by those numbers.
Mm-hmm. You mentioned the president.
It's insane.
Yeah. So, if the president were to put out a mandate, a stay-at-home quarantine, like kind of like we did here with our. You get fined if you're not wearing a mask. If he were to put out something like that, like farmers out in Ohio, it doesn't apply to everyone. So someone in New York, the same rules shouldn't apply to someone who lives, on a beach somewhere where they could go outside and get some sunlight. And so from his responsibility, it really doesn't fall on him. It's more the governors, I think. Even more so, local mayors based on their jurisdiction.
Well, and then it goes back to the individual of, if you are sick and expressing symptoms, just stay home.
Yeah.
Find a way. There are ways to do things without going out, if that's the case. I don't think it should be, a mandated thing from any governing body.
I agree. Like, I haven't seen my grandparents since all this started, for their protection. Like, I've offered to go get groceries and stuff, but they're handling it well. They have someone to go do that and everything, and it's for their protection. They're just being safe, staying at home.
Yeah. Well, and you have to ask.
Since you brought it up, what do you think about the Mobile's mandate?
For masks?
I think it's great.
Oh, I think it's so silly because, well, here's the reason.
Just kidding.
When you go out into a public place, okay, I would say a good portion of people there have masks on their person, but are they wearing them correctly? No. For a surgical mask to be effective, you can only use it once, for one, because once you've touched it, after touching anything in a public place, it's contaminated. N95 masks have to be properly fitted, so if you have any facial hair, it's not properly fitted. And if it doesn't create the seal, it's not properly fitted. And then cloth masks, the moisture issue with them getting too wet while you use them throughout the day. Is anyone washing their cloth mask?
So it does become a petri dish, and you're breathing out CO2. I get the reasoning behind a mask. If you have it, you could stop the transmission.
Yeah,
maybe
absolutely.
A little, maybe a tiny bit. I can understand the thinking behind it, and I think it's more of a way to appeal to people. To say,
think
hey,
it's kind of a pacifier, like a fear thing. Yeah.
I agree, and
herd mentality.
I will say that even though the ordinance did pass, which is unfortunate in my opinion that they have to force that. It is good that the police aren't like handing out tickets left and right. They have masks to give you. I think that's a better way to go about it instead of them just ransacking businesses and stuff like that.
Yeah, and the mandate was written for that. It was set up so that if you are in public and someone reports you for not wearing a mask, a police officer will come and try to reach an agreement with you, which is either you leave or you put on the mask they provide for you.
Yeah, so they're doing that.
And,
decent. But my thing is, Fauci, not to get political, did say that don't wear the masks, save them for the people who need them in the hospitals. They don't do anything. They're not effective at containing the virus, and now it's become a mandate. So we've gone 180 degrees here.
And kind of the idea there is, and I got an email. I'm sure it was a canned email from Mayor Stimson, explaining that basically all that, that it's kind of like, well, other cities are doing it, and that's the feeling that you get with it is it's herd mentality that, one jumps on the bandwagon and then everybody else starts doing it when the reality is nobody's really, well, let's just be honest, they're not scientists.
No one's sure if it works.
Even scientists can't agree on if they actually work. So what it lends one to think is that it really has very, very little to do with the actual transmission of this virus. And I think that's the dangerous thing beyond all of this is, there's typically underlying motives with all of it. Not from your local mayor. I'm not saying Sandy Stimson is understanding this. And I don't think he's in Bill Gates' pocket. But it's very easy to see where this is going when you understand all of the agenda behind it. That it's much easier to accept a face mask. Yeah. And they get you to just think, oh, it's not a big deal, just wear a face mask. I mean, it was not a big deal. Hate to bring it there, but it wasn't a big deal to tell Jews that they had to wear a star on their sleeve. It wasn't a big deal. I mean, it's just a star. It's just so that we know who you are, so that we can identify, for whatever reasons, but everybody knows the end of that story. Yeah, it wasn't about wearing a patch on your arm. It was about a bigger objective. And, when you start getting everybody to wear a mask in order to protect others, which we know scientifically isn't sound, nor does it protect you, then it becomes basically an outward an outward provision that now you're doing something to protect the community. Well, now the bait and switch is already in place. We can now put out the vaccine, which we all know is coming. And now the big picture comes into play that, okay, we can either accept the truth that we're going to all have to walk around and wear a mask for the next God knows how many years that they want to drag this thing out, or it's real simple. If you just get behind us with the mandatory vaccine, this will all go away.
And have your little vaccine paper that proves you're immune, and
yeah, it'll all go away.
It becomes a signal, like a virtue signal. So, like, if you're not wearing a mask in public now, especially, you'll get dirty looks. Like, if you pull it down and take a breath,
you
people
don't
give
care
you looks.
about the people around you.
I saw a guy in Target the other day. He had pulled the whole thing down. It was a face covering, and he was just like shopping, and like, obviously I'm not gonna say anything, but I felt for him. Like, dude, someone's about to come up, and it's so weird to think that that's the new normal, as you're not wearing a mask. What's wrong with you? You know. And Del Bigtree, I know you're probably aware of him.
Mm-hmm.
He has a show, I think it's called The High Wire.
The High Wire.
Yeah, he had a kit on and had different type of face masks. He had one of the surgical ones. He had just a little piece of cloth. He had the face shield, and he had a CO2 tester. And he was testing CO2 under the masks as the kid breathed it out. So initially it didn't raise too high, but he got over to 5,000 parts per million in every one of the masks except for the face shield. It did get pretty high because it was blocking CO2 from leaving the area, but that's all higher than occupational hazard levels of CO2. And that's our waste product, that you're breathing back in. So people with like lung issues as well, I feel for them. And one more thing, the masks give you a false sense of security. So if you are immunosuppressed and you see everyone wear a mask, you might feel like it's a little safer to go out. And I think that could backfire as well. Mm-hmm. That might make people feel I'm safe, and really they're putting themselves more at risk.
And not practice the other hygiene practices that are actually effective.
Right.
At not transmitting.
That are more effective.
And that brings up the big, the big addition of that thought too, that, is this really about public security and safety? I have to call BS, because if it were really about that, we would be doing the things that are obvious in getting people healthy. Mm-hmm. We would be talking about vitamin D. Yeah, I heard you mention a vitamin D study. Did you have that information?
I got all of it.
Yeah.
So
go with the vitamin D study.
I didn't want to mess up any numbers because it gets real specific. So we had a retrospective cohort study in Indonesia that looked on past patients who did die from this disease, and as well as their levels testing. So the way that this virus attacks, it's through ACE2 enzyme, which is angiotensin converting enzyme 2. Vitamin D's been shown previously to alleviate, it's called lipopolysaccharide-induced acute lung injury. So the same way that this virus attacks us, vitamin D actually helps kind of heal that pathway and heal the enzyme there. But from this study, it found that only 16 out of the 388 with normal vitamin D status died, and only 28 out of the 392 with insufficient or deficient vitamin D status survived. And I want to say that because there's a difference between being deficient and insufficient in something. Just because you don't have rickets or you don't have osteomalacia as an adult doesn't mean you're not at sufficient levels. That's a really important thing. Other benefits from this study for vitamin D: it decreased the frequency of falls and fractures, prevented cardiovascular diseases, reduced symptoms of colds or other, or the flu. They said benefits also were shown in people with diabetes mellitus, multiple sclerosis, Crohn's disease, pain, depression, and possibly autism, which phenomenal for one little hormone, vitamin D. They mentioned that the doses were given up to 50,000 IUs for rapid repletion, 1,000 to 2,000 IUs a day. And when I'm not getting sunlight, I'll take 3,000-4,000 IUs a day, especially during these times. But they also found that inverse correlation between vitamin D levels and severity of symptoms. So it's something that everyone could do. Vitamin D is pretty cheap, and we live down here, and they're telling people not to go to the beach at one point. That's literally the best way to get vitamin D.
It's insane.
Yeah, and you can't.
California shut down beaches
again.
Yeah,
and you
the
can't,
place where you go to get sunlight.
You can't overdose on, you can't overdose on sun exposure, but you can't produce too much vitamin D by laying in the sun. Like, your body will produce it in metabolites and get rid of it. But you can't get, skin cancer and all that. But you need sufficient UVB rays to produce vitamin D, and that's true if you're a darker skin tone. You're going to need more and more and more than someone that looks like me. So, vitamin D, that's massive. We've mentioned vitamin C before. Any kind of adaptogens, any way to deal with stress. Very important.
Stress is the huge one, because right now with the media, social media especially, I mean, if you've seen anyone on social media, all that's happening is bashing people who aren't conforming to what is being told by the fear-mongering media to do. And I think that causes a lot of issues with people who are having trouble with anxiety and depression right now, because they're being told, stay away from your support system, stay at home, everything's going to get you. And I don't think that's a great way to foster a healthy immune system.
It's funny that you said that, being that we're on Facebook, because I'm like, wait, what? The Facebook, of course, is all about social engineering, and so you get exposed to things that are similar to your beliefs, and they tend to show you, I tend to see the same post from like people that oftentimes I don't even know who they are. They're just on my friends list, but I see their posts consistently, and I'm like, why am I seeing this person post everything?
Yeah.
And it's always, and that's because of the engineering aspect of it. Even though I've got, 15, 1,600 people on there, I see the same things from people that I don't know. That's how it works. They tend to parse you out with people that are posting similar stuff. So, like, on my Facebook post, I only see, a lot of things that are, like, people posting about COVID not being, everything it is, and articles, that are showing the other side of it. That's what I see all the time. I don't see people that are negative on there. But I know other people, when they post about negative stuff and they're, yelling the F word about, on their Facebook feed about people not wearing freaking masks, and everything else, that's all they tend to see. Mm-hmm. So they tend to, so it's messed up because it's engineering it to where everybody thinks that they're the majority. And unfortunately, you don't. If you're watching social media or the media, you don't know what the majority is. You have no clue what the majority is, because you're only seeing your majority in your little confined world that social media has proposed for you.
Puts up walls for you. Yeah,
it's crazy.
We have a question from a Melissa. Should you be tested for vitamin D levels? And I know that we offer third-party testing. Mm-hmm. For anyone that's a patient. I mean, if you take enough, you probably won't be deficient, barring that you don't have any kind of dysfunction in the body. But they actually will test for, I think it's 25-dihydroxy vitamin D, so the precursor to the usable one. They can do that pretty easy through blood test, right?
Oh yeah, it's a blood spot test. So, we've been doing vitamin D testing in this clinic for probably 12 years at this point, something like that. I remember probably 7 years ago, someone brought in an article from the from the cover of the local magazine. It was AL, whatever, the Mobile Press Register, and the head article was Doctor at USA finds 90% or however many of her patients deficient in vitamin D. Like, it was this revolutionary thing. And I remember, like, the patient brought it in to me and was like, hey, you're going to get a kick out of this. Look, they're finally catching up. And that's the reality. Is now a lot of doctors are catching up and realizing that vitamin D is important. But it's like, come on. Anybody that's really doing things for the sake of health has been testing for well more than a decade. As we say on one of our T-shirts, we were crunchy before it was cool.
Yeah.
Like, it's these things haven't changed throughout history, that you need sunlight. But some were late to the party. Yeah. So yes, you can absolutely get tested. Here's what you want to see: the numbers on the tests. If you guys have had your vitamin D levels checked, the minimum level, according to the authorities, is like 30. That you want to be around 30 to be normal. That is not sufficient. Yeah. That is like, you're not clinical anymore.
That's not osteomalacia. I think 30 nanograms per deciliter. I think. Yeah,
It's
that's above osteomalacia levels.
yeah. So that's at that point you're not exhibiting symptoms. That does not mean that you're sufficient in your vitamin D. You really want to be between 50 and 80. 50 and 80 is a sweet spot according to most experts. And it's funny though, because we'll get people that will get told even now by their MD, oh, my MD said, they took my blood test or my vitamin D, and they said that my vitamin D was too high, and I need to stop taking vitamin D. I said, well, that's interesting because you're not taking that much. And so I say, okay, well, bring in your test, and they bring it back in, and they're at like 82. But because that's not in the 30 to 50 range, that of course their test is showing, they're telling that it's too high, then they need to stop taking vitamin D. No. Sorry, no. I mean, even if you were at around 100, is that going to cause you problems? No, not at all. So, you really want to be in that 50 to 80. And for most adults, that means 5,000 IUs a day of vitamin D. Yeah. Get sufficient sunlight, but especially down here on the coast where we get lots of sun, we're blessed. I mean, it's hot, but we get lots of vitamin D.
Yeah, I did a video probably back in March that was for the City of Mobile. It was talking about vitamin D, and I think in there I saw a study that in Japan they had tested people with vitamin D levels and found that symptoms weren't really found until it was like 250 nanograms per deciliter. So we have a really high tolerance for something that they're going to label that's too much over 50 nanograms.
Yep.
But you mentioned like being down here, we get more sunlight, that helps. A few key facts about the virus: the most severe outbreak in the north, in Europe. So it was in the north part of Italy where it is noted that vitamin D deficiency is one of the highest in Europe. Another thing was Japan is an outlier in the north part. With only a very mild outbreak and its lowest incidence of vitamin D deficiency thanks to its high fish content diet. So fish obviously contain a lot of vitamin D, even more so if you eat the liver. We mentioned before the enzyme that COVID enters as well. Vitamin D protects through that as well, that pathway. But yeah, where you live plays a key fact on vitamin D levels. And I kind of believe that we'll see less severe symptoms with people who live on the beach that are getting out, nice fresh air, not cooped up. But I mean, no research is going to be done on that. Let's be real. No research is going to look at me versus someone in New York, I don't think.
No, I mean, the media is hammering, of course, all they can, Florida and Texas, because those were the two states that were opening. Mm-hmm. I mean, that's just, and even Alabama, to a degree, they're also trying to, point fingers at. But you're right, we're not going to see it.
Yeah,
we're not going to see the numbers that came out of New York and New Jersey. Ironically, kind of isolated in that little area in the first, bit between March and April. We're not going to see it. I mean, it's not a matter of putting our necks out to say that. It's just not going to happen. Mm-hmm. So. And I want to point out this other chart here, laying the data over itself just to kind of paint the picture. This was the first one that I had posted today that just simply takes the number of total cases and the number of deaths and puts them on the same graph. Because that, when you look at graphs, all you see, when you isolate the data from one to another, and of course, people that are into data crunching and creating graphs and everything, that this becomes messy to them. They look at that, oh, you can't do that, because you're putting two, things. But I'm sorry, but being sick and dead are correlated. Mm-hmm. They do go on the same. I mean, they are relevant to each other. And when you see that we have almost 4 million people that have been tested positive, and yet the death rate barely gets above. I mean, it's not anywhere near 1 million. We're at 138,000 deaths.
And I don't know if people can see that's linear, not exponential. That's a flat line.
Yep. It barely gets above the line, when you look at it in correlation. And like I said, some people have picked that apart, but I already know what the mentality is there. So I mean, go ahead, you pick it apart, but anybody that, is rational is going to look at that and be able to put the pieces together and say, okay,
And I know you've been active on Facebook. There is one guy that comes to mind, and no matter what amount of evidence you seem to present him, he'll come back the next week saying, "I read this headline. Here's, from this news source is attacking your state. How do you feel you're responsible for this?" And you hit him back with some facts, and I'm sure you don't hear anything.
Zero response
until he has something else to send you.
Yeah, it's not, because this is not about science. It's about politics. Mm-hmm. It always has been. It's unbelievable that we would use a virus to be so political, but it is, because it's not about the outbreak. It's not about the pandemic. It's about what the agenda is, which, as we've laid out month after month after month on videos and emails and articles, it's been perfectly predictable. And they, at one point, if you remember, they said that we were going to have 2.5 million deaths in the United States. And I was laughing at people saying that is absolutely ridiculous. Do we think it's funny that people are dying? No. Nobody. But the idiocracy of trying to blow stuff up in foresight for an agenda, and then those same people try to bash you, saying that you're trying to look at numbers in hindsight and paint an agenda.
Yeah.
Are you kidding me? Like, you can project out whatever the hell you want to, but we can't show you what's actually happened to prove that you're an idiot?
It's a very emotional topic when you're talking about death. So one death is one too many. I mean, you hear that all the time. Like, you're insensitive for downplaying the deaths that could happen.
Yep.
That, I agree, that's idiotic. Like, we need to talk about facts, and facts only, not emotions. We can't make policy based on what appeases everyone. It needs to be factual and not off people's emotions. And that's, unfortunately, what generates headlines, is things that trigger emotions. For sure.
Doesn't seem to be a problem with, how many millions of babies are aborted every year? I mean, if we want to talk about deaths, why are people okay with that? But,
unfortunately, that's another political.
Yeah. But we are, but somehow we're evil doers because we're trying to rationalize, not minimize, the fact that that it was never going to be 2.5 million deaths, that it's 130, and the only reason we got there is because they lightened the diagnostic criteria. They searched out everything they possibly could. They monetarily incentivized people to be COVID positive, and labeled on their death certificate. I mean, I've talked to, I don't know how many people that they have lost a family member, an older family member or somebody with comorbidities, did not die from COVID.
Yeah.
Did not die from anything respiratory. They knew what it was, and yet when they got their certificate, it said COVID on there, because the hospitals make more money that way. So when you incentivize people and you lighten the criteria where you can go on suspicion only, you don't actually have to have proof. I mean, that's like saying that, okay, well, our adjustment is X amount, but if you think that the patient has headaches, we're going to reimburse you at 5, 10, 50 times the normal reimbursement rate. We may not do it out of principle, but I think you can guess how many chiropractors out there would be labeling headaches on every freaking patient that has a head.
That has ever experienced a headache. Yeah.
Absolutely.
Yeah.
And
so
I think
it's a no-brainer.
That's what, for me, I want to ask, where's the outrage for that? The manipulation of statistics and misrepresenting information. And stuff like this has been happening for a long time with polio. Whenever the polio vaccine was created and it started being diagnosed as meningitis or whatever, had been diagnosed.
Even Bell's palsy.
Previously, polio.
Any form of paralysis.
Yeah.
Any form was polio before the vaccine came out.
Yeah, I think
and then it's like, oh wow, polio just went away. Right. We are cured.
Yeah.
And I feel like that is, can we say in 5 or 10 years, if a coronavirus vaccine comes out and then we miraculously don't ever have coronavirus anymore? I mean, it was falsely coded in the first
exactly
place.
where it's going.
That's a good point. No, I haven't thought, like, when vaccines come out, oh, have you gotten the vaccine? Yeah. Well, okay, let's not put
It can't be
coronavirus on
this,
their
yeah.
exit forms.
Mm-hmm.
And not only that, but you know, we know now there's you can look all this information up about the way that they do the tests. That the test, this RNA test that they're doing, isn't specific to just COVID-19. It's picking up common colds, any kind of coronavirus, which, you know, every single season for the history of mankind, people have been getting respiratory infections. And they do a test and it doesn't come back influenza, because there's a whole breed of coronaviruses and they're catching all of them. But you can put money on it. Man, I wish we could.
You probably
Well, you probably can. Where once they come out with a vaccine, they're also going to release better, more specific tests.
Interesting.
And all of a sudden, all these ones that are positive now are going to come back negative. And that doesn't even address the ones where, like, I saw someone post that a nurse practitioner that they knew took 100 COVID-19 tests. They dipped all 100 of them in saline solution and sent them off to the lab. 63 of them came back positive.
The saline had corona in it.
Apparently, saline solution has corona. How does that happen? 63 out of 100 false positives?
Yeah.
That's insane. And on top of that, we've also seen posts where people have gotten in line to get testing done, but saw that the line was going to take like, you know, an hour and a half, and they're like, "No, this is stupid." So they got up and they left, and they just drove away. And then, a matter of a week later, they got notification in the mail that they tested positive. They never got tested.
Yeah.
So, yeah.
And you mentioned the fear behind it. So, I have a patient who, and as against we are, as you know, we're pretty against surgeries and everything, but unless needed. And this guy needs a surgery. He needs both knees replaced. They're pretty worn down. He's deathly afraid of going into the hospital right now, because if he's got a pre-existing condition, if he catches corona, he's worried that he might not get the best treatment, because there's that incentive to code him if he's got corona. He's of age for Medicare. It probably not the best look for the hospital that your patients are afraid to come in to get the needed surgeries. And I feel that, like, that's crazy. The incentivizing people to be sick or incentivizing based on a diagnosis is just, it's asinine.
And that's why so many hospitals are understaffed now, or not understaffed in the sense that they don't have enough, which used to be the problem. It's the opposite now. They're furloughing staff because they have nothing to do. We have patients that have been cut.
Brother used all of his
PTO.
Yeah, he's used all of his PTO, and now he's actually having to lose out on hours because he's not asked to work one day a
They
week.
were forcing people to take PTO for a while. I've heard several instances of that.
So we take a hike every year, physical activity. He can't do that this year because he's burned through his PTO for coronavirus.
Yet at the same time, curiously, when all the cases were going to, when all of this catastrophe was happening in particular hospitals in New York and New Jersey, they were not allowing outside nurses and doctors that had gone there to volunteer. They were not allowing them in to help.
Yeah.
They were rejecting people and saying, no, we're keeping it contained, even though it wasn't. So that's a massive curiosity. There's so much mess, but yeah, that's political. You're not at this point. It's so divided that you're not going to sway either side. I think it's very unlikely that you sway the other side. Most people that are even watching this already think one way or the other. They either think we're imbeciles for talking like this, or they're sitting there saying, yeah, and putting hearts up on the screen and stuff. Like, this is how I think. And that's the culture, unfortunately.
Yeah, I think we'll see pushback though pretty soon, because I heard on the 106.5 on the radio, in the morning it's the news, and then in the evening it's football. And coming into work today, they mentioned maybe canceling college football.
Oh,
you can't
snap.
do that now.
Oh, snap.
And not only
Game
that,
over.
worst case scenario, if they cancel the season, they'll push it back to the spring. So we'd have to wait until the spring for a college football season. That's not going to happen. I think we'll see.
that.
I think we'll see pushback. As we approach college football season for sure.
Although Liverpool, they said that they're already projecting that, and this is for soccer in Europe, that they're going to be limiting capacity in the stadiums for the upcoming season to 40%.
Whew.
And I'm sorry, but I cannot imagine going to Anfield and it only being 40%. Like, no. Unless it's packed, it ain't the same.
No, it's not.
So,
But then again, if you want to take those bets, you can start betting for the away teams.
yeah.
That plays a big thing in sports is the home team crowd. I think
Yeah.
Thumbs up and in.
Closing thoughts?
I just think we all really need to use our heads. You can't be scared if you are confident that you have a strong immune system. And if you don't have a strong immune system, do what you can to strengthen it, but make choices that can keep yourself safe.
Yeah, I agree.
And don't buy into the fear. There are a lot of things you can do instead of seeing any, media-driven fear.
And stress will deplete your immune system too.
Yeah.
And, I think my dominant thought through all of this is kind of the other side that we don't talk about enough. And that's the fact that we need to, as human beings, we need to see each other's faces. Mm-hmm. We need to be in contact with other people. We can't not shake hands. We can't not hug our family members. I can't believe you even see stuff like this, but articles that say that couples should wear face masks during marital activities. Like, this is insanity. Mm-hmm. We as human beings need to have interaction. We register thoughts and patterns, and we gauge emotions based on what you see on other people's faces. And when you hide all that out, I think there is a lot more agenda than even just what we're seeing. That this is about creating disconnection in society. It's as we've said, social engineering.
Yeah.
And when you take away, it's look at the basic premise of it. How many people get into battles on text messages and behind sitting on their keyboards saying things that they would never say if they looked at your face.
100%. Yeah.
Never say if they looked at your face. And that just proves the point that we require and we need that. And that's what I fight to not get taken away. It's to me, it's not about wearing a face mask or not. It's that my relationships with people is much more real than this virus is.
Yeah.
Well, and what amount of your life and existence are you willing to give up to avoid dying from a disease that you have a 3.9% chance of dying from in the U.S.? You mentioned not seeing your grandparents.
Mm-hmm. And that number is based on just the confirmed cases.
Right.
If it's tenfold of that, which they're saying it is, it's 0.3.
The asymptomatic carriers and things like that never get tested.
How much experience in your life? Like, can you just live your whole life afraid and hiding from a virus that you may never get, or even if you get, may not die from? What are you sacrificing for that?
If something, God forbid, happened to my grandparents and I hadn't seen them since, before this, I'd regret it, for the rest of my life. And you mentioned the disconnect between family members. I did see a video on Facebook, and it was two cousins that hadn't seen each other, since before the lockdown, and they were both like back to back, and they turned around and they were both crying, hugging each other.
The little kids.
Yeah, and it was really sweet, and I was like, this is tugging at my heartstrings. But then I was like, wait, why did y'all split them up for so long?
Yeah.
Like, they're kids. These are the lowest risk, for dying from this disease. If they're immunosuppressed, they should not be doing that, because this is still active. But I figured that they weren't, and that's kind of, I don't know, it wouldn't make sense, to have the kids go through this much stress at a young age.
And in that vein, a lot of people have been separated from each other or completely isolating altogether. What do you think is going to happen whenever we all decide that, now is finally time to go back out? I mean, what happens every year when kids go back to school? Everyone gets sick.
Mm-hmm.
And so, of course we're going to see an uptick in all kinds of illnesses once we all stop isolating and separating ourselves, social distancing.
And they're stuck inside. They're not getting, their immune systems are tanked.
Yeah.
They're going to go immediately into an area where they're probably going to catch a few things.
So when do we decide that, enough is enough?
We don't.
Yeah.
That's the answer. Is they have the way they see it, they have a never-ending stream of revenues because of all of these indistinguishable virus. I mean, how many hundreds, thousands of viruses do we get exposed to every single day? Every single one of those can be seen as an opportunity because they'll give you a vaccine for COVID, and then once they've made millions off of that, something, or billions off of that, something else, they'll just redirect the thought. It's a never-ending train of profits. So we either figure it out now and affect policy, or we will all suffer the consequences. All right. Anything else? Guys, if you have any questions, of course, put them in the comment section afterwards, and we'll do our best to get on there and answer any of them that you can. If you found this relevant, share with a friend, tag a friend, give us a thumbs up. If you have not gotten on and liked our page, Liberation Chiropractic, get on there. If you're not a patient, maybe you should be. If you're in the area, we've got 3 doctors that are here ready to help and ready to serve, and we're open and at it. So come in and work on getting yourself healthy, because that's really what all of this should be about: is staying healthy, staying fit, staying happy. And last thought, go hug someone. All right, y'all. Have a great night.
Take care.